Hello, everyone. So we discussed about the jugular foramen in the previous video. In this video, we'll be discussing about the superior orbital fissure. So this here in the diagram is the superior orbital fissure, right? So this side is the, as I told you, this is the interior view, and this one is the base of the skull. So interior of the cranium, you can see the superior orbital fissure. But if you see the base of the skull, you will not be able to see the superior orbital fissure. Rather, you will see this inferior orbital fissure. Now, if you want to clearly see the superior orbital fissure, let me show you another view. Let's go back. Let me just clear it out. And now we'll be able to see, in this picture, you'll be able to see the superior orbital fissure. So this one is the superior orbital fissure. This one is the inferior orbital fissure. Okay. Now, in this picture, as I told you, this is the superior orbital fissure on both sides. And this one is the inferior orbital fissure, as this is the base of the skull. Now, when we talk about the inferior orbital fissure, the structures passing through this fissure, let's see in an enhanced magnified view. So this is the magnified view of the superior orbital fissure. Let's see in the next diagram. Now, this is the superior orbital fissure. Now, this is the superior aspect. We have the inferior, we have the medial aspect, and this is the lateral aspect. Now, this entire structure, this upper one is the superior orbital fissure. The lower one is the inferior orbital fissure. There is a ring here, which is known as the tendinous ring of Zinn. Okay. Now, let's see how the structures pass through it. Now, if we see the superolateral aspect, the various structures passing through the superior orbital fissure are the lacrimal and frontal nerves. Now, these lacrimal and frontal nerves are part of the ophthalmic division of the trigeminal nerve. So this is the first division of the trigeminal nerve. That is why it is written as 5A. Okay. So these are the lacrimal and the frontal nerves which pass through this superolateral aspect. But if you see one of the branches of this first part of the trigeminal nerve, which is the ophthalmic nerve, is known as nasociliary nerve. But this nasociliary nerve passes right here. Okay. Now, in the same aspect, superior ophthalmic vein also passes through the superior orbital fissure and the trochlear nerve. So we can say till now nerves number 4 and 5 are passing through this aspect. Now, if we go to this part, here we have the superior division of the oculomotor nerve. So oculomotor nerve is cranial nerve number 3. It has two divisions, superior and inferior division. So the superior and inferior division of the oculomotor nerve passes through this aspect. Apart from that, we have already seen the nasociliary nerve, right? And also the abducent nerve. Abducent nerve is number 6. So all in all, cranial nerves number 3, 4, 5 divisions and 6. All of them passes through this superior orbital fissure. Apart from that, if you see this side, this is the optic canal. This is also included in this tendinous ring, but they're not passing through superior orbital fissure. The structures passing through superior orbital fissure are only these ones. Now, if we see the inferior part, there is inferior ophthalmic veins, which passes through the superior orbital fissure as well as the inferior orbital fissure. Now, in the next session, we'll learn about other foramens. Thank you and have a nice day.